Amazing grace, how sweet the sound. You know that particular song? And there's one aspect that resonates so much. He said, I was once lost, but now I am found. I was blind, but now I can see. Those lyrics are so powerful to me.
This is a podcast called Walk, Talk, Listen. An attempt to connect people and make this world a bit better by sharing opinions and experiences based on the belief that everyone's perspective is true, albeit partial. My name is Maurice Blom, and I would like to welcome you to yet another episode of Walk, Talk, Listen.
Okay, good day, everybody. This is another episode of the podcast Walk, Talk, Listen. And as always, I'm delighted with today's guest who will introduce himself. Peter, please go ahead.
Yeah, thank you very much. I'm Peter Yeboah from Ghana, and I was born in a village in Ghana called Brekum in the Brahafo, in the middle part of Ghana. That takes probably about 6 to 7 hour drive from the capital city to that particular village. So my birth, growth, and reach to this stage is it's an interesting story of faith and family. Faith, in the sense that my father was a teacher and a catechist of the Roman Catholic faith, married to my mother. And my father was Joseph, and my mother was Mary. So you could see that immediate connection between Joseph and Mary marriage, meaning that we were so much steeped into Christian family values right at the outset, all throughout from our birth, attending Mass every day, and also being taught and formed through typical Christian values and Catholic principles, ethics, and morality. My mother was a farmer and a trader, a farmer who had to till the land, grow crops to feed us, and also go to the market to sell some of the products. So that combination of a teacher who was guiding my intellectual, capabilities, and a mother also tilling the farms with patience and the rest. That intersection and combination formed me uh, into one, the intellectual component, and a compassionate, family value oriented type of person that has shaped the way I conceive the world, the way I interact, fraternize, the way I work. And my whole philosophy and paradigm in life is about how can I really have that cognitive capability, harness that through emotional intelligence, social connections, and see how I can impact the world at scale, at all levels. So that is how I've been formed. Faith and family values combined in a way that guides and directs my thoughts, actions, and interactions.
Wow. Yeah, and thanks for sharing that, Peter. But you have to allow me to ask a question with, it's a little bit jokingly, but maybe there is some interesting background information because you said your father was called Joseph and your mother Maria, right?
Yes,
So you were not called Jesus, but you were called Peter. And for those who are not familiar with the Christianity story, Peter was the leader of the apostles. Let's call it this way, and he denied Jesus 3 times, right? So yeah, uh, tell us
yes,
about this.
yes,
Yeah.
that's very interesting. And the beauty of this whole thing is that probably let me analyze that my parents
Mm.
gave birth to 14 children. Now we are left with nine, six
Wow.
men
Okay.
and three women. Now, out of
Yeah.
which
Yeah.
two of them are Catholic priests, and
Oh.
and the first Catholic priest is called Joseph. The other one is called Francis. But I'm the only Peter. Interestingly, you realize that I'm the sixth born out of the nine, even though Peter denied Jesus Christ, but he was vested with leadership. He was a rock of the church. He was somebody who was trusted and entrusted with the responsibility of taking over the rooms and rebuilding the Christian faith and the rest. So possibly it's about how Christ goes into the innermost parts of a person and ignores probably the unintended acts that come along, and recognize the fact that even in our weaknesses and our fallout, there are great potentials to harness, and that informs the way I see everything. That there's always a golden opportunity out of every crisis that we must harness. And probably I'm living the way to that leadership. And interestingly, I have had leadership positions throughout from childhood to date. And therefore, that's it very well. That's just what I do.
And I mean, just to make sure, the listeners as well as Peter, I'm teasing Peter here, right? This is a joke. So, um, and you should not take me too seriously anyway. Um, so Peter, I mean, it's interesting that you had so many siblings and two went into, um, studied theology, right?
Yeah, theology, philosophy, and the rest of your
Philosophy.
day.
Okay.
Yeah,
So
yeah.
tell us that, yeah, how did you then ultimately end up where you are now today? Because I read your bio. You went to the Netherlands, for example, at KIT. Um, yeah. So tell us a bit about your journey.
Yeah, very well. So, with that background, I
Mm-hmm.
naturally went to a Catholic school,
Mm-hmm.
right from infancy, primary school, middle school, and then I managed to enter into secondary school. And of course, it was out of some resilience and determination to go out of nine children, and some had to be sacrificed. But I was very insistent going to school. And then, whilst going to secondary school, I went to a Baptist school, and that was once again religious. And then went to University of Ghana, where I studied. So throughout my journey into all those schools, I was almost always every day had interaction with the religious aspect of life, that interface between religion and education. Because you go to Catholic school, you must, as it were, attend morning mass before classes began. And so when I was also entering the university, I, in a way, was looking out for ways and means to support the growth and development of which, even if I did not become a priest, I have an opportunity to work with the church as the largest development agency. Remember, the church is involved in education, health, interfaith platforms, economic development, and the rest. So I did a program called a program that is health services management that made me become hospital administrator. So in the course of having the first degree, in every vacation, I was working in hospital, trying to see how I can be mentored by practicing administrators. So immediately I finished school. This is an interesting catch. The very hospital I was born, at its Holy Family Hospital, Brukum, was where I began work. I
Really?
made my house, yeah, house of his job, and I
Mm-hmm.
became the administrator of that particular hospital that I worked. That was just barely 24 years after being born. I went back to that facility, and the interesting catch is this: the doctor and the midwife that conducted the delivery, supervised my mother's delivery of me, were there working. The doctor is a sister called Sister Fernand Pelletier, and the midwife was it. So it was once again back to the roots where I was born.
Yeah.
And after working for some time, I had a chance to be promoted and transferred to another Holy Family Hospital as a senior administrator. From there, I became director of a diocesan facility where I supervised about 6 hospitals. And then I had opportunity to go and study. After uh, 13 years of utilizing my first degree, I had Norfolk Development Scholarship. That is the Dutch fellowship program where I did masters in public health at the Royal Tropical Institute. And just afterwards I came back because I had skills to come back to help reformulate, reconceptualize the way health was designed and delivered, to have the more public health component, because I saw some level of mission drift where instead of looking at holistic health services, we're only looking at clinical creative component, neglecting disease prevention and health promotion, rehabilitation, palliative, and all mental health services, because Ghana had a health insurance scheme that incentivizes disease treatment. And in a way, we were drifting off. So my coming back helped me to really shape other developmental projects and programs with other partners, and it was very helpful. Then, after some time, I had another scholarship to go to London School of Hygiene and Tropical Medicine and London School of Economics to look at health policy planning and financing, for me to situate how all the field lessons that could be shaped into policy and planning and influence the way health policies formulated and implemented. So it was very interesting. And in all this, I will learn and go back to the very place that I worked. And after going back and working for some time, I had another opportunity to lead at the national level, where over the past 10 years, I have become the executive director of the Christian Health Association of Ghana, an organization that is the second largest provider of health services, the largest non-state actor for health services, and leading the synergy, the coming together of 42 denominational groupings with almost 400 health facilities and 22 health training institutions, training nurses, midwife, physiotherapy, and orthotic technicians, providing health services to the whole region, and having that presence and reach in underserved areas of the country, targeting the unserved, marginalized, and the poorly served and underserved societies. So it's been very much exciting at this level where my growth and my bringing the faith and family values, that intellectual orientation, and that determination to promote Jesus Christ Healing Ministry has informed the way I think, I act, I connect, and I build alliances and partnership that would help promote that noble cause of making healthcare services affordable, accessible, and equitably available to everyone that need it most.
Wow, that's quite a story, an incredible story. I would like to ask you a couple of questions about the Christian Health Association of Ghana. But before we go there, you mentioned two, um, quite famous universities, institutions in the field of health and public health. The first one was Royal Institute of the Tropics,
That
I
is
think, right?
Royal Tropical Institute.
Yeah, sorry, I'm used to the Dutch names, the
Yeah, yeah,
Koninklijk
it's,
Instituut of the Tropen, so but the
yeah,
English
yeah,
name
yeah.
is different.
Probably.
And then the UK one. If I ask you to mention one thing about what you learned in Amsterdam at the Royal Institute of the Tropics, and as well as the other um, London School, right, of hygiene,
Yeah, yes,
what would that be?
yes. So that's an interesting question. I had worked with Dutch doctors at the hospital level, and I had also worked with partners from Holland, from the Netherlands, um, Cordate, and other actors. And I had admired the way their industry, their sense of social impact and the rest. So when I finally had opportunity to study in Amsterdam, I was pleasantly surprised with several aspects. One have been was the sense of industry, intellectual firepower. I mean, how robust intellectual life was, and the Calvinist philosophy of survival of the fittest out of the lot. And how direct the Dutch people were. And most importantly, in the academic field, I saw the practical aspect, that the fair balance between theory and practice. The Dutch mode of education was you learn the theory, you practice tomorrow. So I had an opportunity to have one of the most exciting and interesting intellectual um, experience in Holland, where practitioners on the field from WHO came to teach us. People who had industry experiences, field experiences came in. Professors from UK coming to teach us. And so right out there, it was a departure from what I've known to all theories throughout, and probably wait for a better time to activate the theory through practical orientation. And so what I learned in Holland was one organization. That, I mean, I saw the Netherlands being very compact, well organized. The train system, everything worked very well. But then intellectually, that robustness, intellectual capability being enhanced, practical aspect always experience, assignment. You could live in the Netherlands, study for 10 years, and unless the course coordinator plans for you to go out, I can tell you'll be busy throughout. And so I think that that aspect of theory and interface of theory and practice in the Netherlands was very much helpful. And coming back home, I acquired new mode of thinking, get the theory, get the context to inform the content, demonstrate practical, action you've learned, and show results. That was the beauty that I learned in the Netherlands. Of course, apart from the tulips and of course the cheese, the thege, the hobbydag, and the rest. I mean, I found Netherlands very an interesting destination for intellectual illumination. That is what I learned in the Netherlands, and I'm always very much grateful. And I have a lot of good memories about my time in the Royal Tropical Institute of Amsterdam, Cape, for sure.
Mm. Okay. And
Probably
just to
won't go to much
just just to
Yes.
make sure is because the listeners know that I'm from the Netherlands, that I did not pay you, to
Oh,
make this
okay.
promotion about the Netherlands, right? Um, no, thanks, Peter. Um, and yeah, what about the UK again? If you would summarize there, how that influenced, how
Yes.
you are working today.
Absolutely. So the UK um, was also another interesting transition from the Dutch environment to the English environment. Of course, I would say Ghana was a former colony of UK and part of the Commonwealth. So language was pretty easier, and it was there. So I had a hybrid program in two universities, London School of Hygiene and Tropical Medicine and London School of Economics combined. So you have your masters from these two prestigious universities. So one was that that branding. Of course, you have a sense of confidence that you've entered into a world class school, and School of Economics has marketing, visibility, and the rest. But I was also very much interested in intrigued in finding out world class researchers in health policy arena, in public health, and all the other areas. So the, my the learning I had in these two institutions had been robust theories, research capabilities, ability to build partnerships and relationships across the globe, and having that sense of confidence to interact and fraternize with all manner of people, being nuanced in theoretical concepts like efficiency, equity, economy, and all the other aspects. And let me say that it was a nice blend, because one of the things I learned in Holland, in the Netherlands, Kate, was the ability to really make a presentation. Remember, I told you that the Netherlands public health was more into theory and practice. You have to learn and present, so assignment and interacting with your class. UK gave me an added value of having much confidence, nuanced in theory, UK is much more into having sound theoretical content, ability to conceptualize and give back to the world, and have several classmates from several arenas, because these are two big universities. So by the time you finish, you would have had that experience of meeting classmates from America, from across the globe, from all parts of the world. So I had a strong intellectual confidence, ability to interact, fraternize, and engage all manner of people, and have the relevant type of language, content, and the confidence to interact with it. So the added value of these two bigger institutions is to have solid foundation and a springboard and a platform on which my work for the past couple of years have been premised. As executive director of CHAG, I deal with all manner of people across the globe. And when I became the chair of the African Christian Health Association platform, it was very helpful. You go to all parts of the world, you come across somebody trained from the Netherlands, and that helps you to align immediately. The mainland Europe education was great. You meet people, and they also schooled in the UK, and you have the confidence and the capability to engage them. And so I would say it was it was a new level of formation, hybrid. The hybrid and interface of the Dutch and UK education has been a value add. And I'm always very happy to cite these two big schools as important mentors and formators of who I am today, and probably who I could be in future, and how I can really um, expand my scope and purview in life.
Hmm. Great. Thanks, Peter, for sharing that. Let us now jump to the Christian Health Association of Ghana. So,
Right.
can you maybe give us a short version of what the organization is trying to do? And then the second part of the question would be, um, what do you hope to leave behind ultimately, right? In the work, what are you working on, or so two things: what is you doing at present, and what do you hope ultimately, when you are going to an older organization or you're retired, and people will speak about your leadership, what you have left
Very well.
behind. Yeah.
Melita, I think that is a very sentimental, thought-provoking question. First, about Christian Health Association of Ghana, which is CHAG. Christian Health Association of Ghana is a health service provider born out of the Christian, born out of Christian principles of service and compassion to the world. It's a coming together of all the faith-inspired health services from all the denominations in Ghana as one representative voice of the Christian community that is bent on promoting Jesus Christ healing ministry. So the vision of CHAG is a healthy nation, Christ healing ministry fulfilled. And our mission is to promote Jesus Christ healing ministry by ensuring that we provide health services that are accessible, affordable, equitable to all manner of people. And so that's what CHAG is. And we were there pre-colonial era, the missionaries were there to provide such services. And at independence, the missionaries were the only viable health service provider. And post-independence, we are still there, complementing government in the provision of health services. But much more for us, health services remain an integral part of our portfolio. Evangelization through health and healing, which is part. And remember that health is part of that like Trinity type of development that the church came in. The church came in with spirituality. Wherever a church is located, on the right hand is a hospital, left hand is a school. So health, education, and the pulpit have been there. So I would say that important arm of health remains something that has high mission impact all over Ghana in terms of its ability to um, formulate innovative health projects and programs. Remember, one of the most impactful program CHAG has had was to design community-based health insurance scheme. pioneered, piloted it for years, which became proof of concept, and for it to be adopted at scale by government. And now Ghana has one of the best social intervention health financing schemes in Africa, Ghana's National Health Insurance Scheme. That was an idea, a pilot project, and a lifelong program of CHAG, which was pioneered, piloted, and nationalized by the National Health Insurance Scheme. So it tells you the type of impact CHAG continues to make, and the fact that we train nurses and midwives professionally and morally and ethically to provide, health services for the entire country. And every year we provide about 5,000 midwives back to the country. We see about 10 million clients or patients all over, and providing comprehensive maternal and child health services, uh, curative, preventive, promotive, curative, rehabilitative, and palliative care. So that is what CHAG is all about, as a compassionate health service provider, innovative in the way it designs and delivers health programs all over. Now, back to me as a leader, I have a sacred responsibility to preserve, protect, and promote the impactful work of early missionaries, and to provide a type of leadership that would sustain the growth and development of Christian health services in the entire country. In terms of the type of legacy I would like to be remembered for, let me tell you the few things that we've done over the past couple of times that I've been here as leader. Um, we we realize that government always has a challenge, or government always needs help. And one of the biggest social capital we have is trust and credibility within the entire system. Community engagement, ability to mobilize the community and formulate projects and programs that are very impactful. So we have been able to come out with several interventions comprising one, safe care quality improvement program. We realize that there are gaps in the way healthcare is delivered. Even though with all best of intentions, we provide services that are not of utmost quality. Healthcare that is not really measured, ranked, or gaps established. So we adopted safe care quality improvement program that's able to measure the state of quality of care, identify gaps and overlaps, and come out with interventions that would remedy some of the known gaps. Thankfully, over the past 5 years, we pioneered and piloted this once again, and it has been adopted by the Ministry of Health as the quality improvement intervention for the entire healthcare sector. The Parliament of Ghana has recognized this. The Ministry of Health has adopted it in its aid memoir as part of their health summit. And the largest public health service provider, Ghana Health Service, has now adopted the Safe Care Quality Improvement Program as the go-to, as an instrument for improving quality, because we realize that healthcare without a quality component is a disaster, and there are many disabilities, discomforts, and harm that is unleashed on clients seeking healthcare services. So that is one key legacy that we pride ourselves in. The second intervention has been supply chain. Ghana has challenges with the supply and the dispensing of high quality medicines. And we realize that there are several artificial challenges, systemic barriers. And so we came with the pool procurement intervention in collaboration with other partners. Pharmacists, once again, a Dutch organization, supported the Safe Care Quality Improvement Program and the pool procurement policy. Now, with respect to the supply chain, by pooling key actors together, most of the hospitals, we are able to negotiate the prices of medicine and to reduce medicine price by at least 25 to 30%. So economies of scale has been achieved. And most importantly, because we negotiate on large scale, we are also able to see how we can regulate the quality of medicines that are delivered at last mile so that a client receiving the medicines, together with Food and Drugs Authority, we're able to use some instrument like TrueScan to check the quality, efficacy of medicine so that people taking medicine in child facilities will have the type of health and healing that is intended. And so all these are programs that have ensured the efficiency, effectiveness, equity, and economy of services that are delivered so that anyone visiting a child facility will have the type of professional, compassionate care that is required. Moving forward in future as the leader, I want leadership to be more transformative, more impactful. I want to be remembered for someone who promoted the type of partnerships, collaboration, and cooperation among key stakeholders that ensured that the health system is more responsive, robust, and resilient to the needs and values and preferences of clients. That we put the patient at the center of all what we do, because all of us are patients in a way. It's only a shifting position. I want to leave a legacy where we have the Christian Health Services still being a leader in formulating innovative healthcare programs and projects that will influence national health policy. We want to ensure that we become the partner, the type of partner that is respected, responsive, credible, and trusted, not only in Ghana, but within the community and within the global space, because we are fully aware that no one can do anything in splendid isolation. That partnership is a pathway to ensuring that sustainable growth and development becomes the instrument for impactful mission across board and across generations. I want to have the type of significance and success that is translated to health and well-being, especially the marginalized, underserved, and promote. I will be a champion of diversity, inclusion, and equity across board. That is what I want to be remembered for.
Oh, that's thanks for that, Peter. That's pretty impressive. And just, I can't imagine, but if the listeners want to know more about CHAG, they
Yeah,
need to go to chag.org.gh, right?
absolutely.
I do have a couple of questions um, that are related. So I mean, the first question is uh, your organization, is it self-sufficient, or do you also have funders that support the
Well,
organization?
yes. So, if you look at a typical faith-based organization, it is founded on partnerships right from its foundation to to every level.
Mm-hmm.
Early missionaries came in and they had a lot of external support to make sure that their noble work is really continues very well. In Ghana, CHAG has a partnership framework with the government of Ghana.
Mm-hmm.
The government of Ghana support us with personnel emoluments, salaries. About 70% of our CHAG institutions are lucky to have the government supporting their salary. But when it comes to infrastructure, equipment, buildings, public health programs, we depend mainly on partners abroad. In the
Okay.
past, we have been privileged to have development partnership with UK Aid, that is a Foreign Commonwealth Development Organization of UK. In the past, it was called DFID. They supported CHAG to roll out mental health program, and that lasted about 5 years. And still, that we've been able to embed that particular program into our service portfolio, that all child facilities that were part of that program have mental health units in the hospitals. So that is one aspect of sustainability that we find. We were also lucky during the COVID times that we had support from UK Aid. They were our main funders and partners. They supported us to implement the COVID response institutional building project that ensured that we complemented government for effective disease management, like case management, surveillance, COVID protocols, and then ensure that our response in the rural areas help to ensure that routine services were not disrupted by COVID. Fast forward, we also implemented Global Fund as principal recipient for some time so that we ensure effective HIV, TB response all over. Recently, we were also privileged to have had in the past USAID project that was discontinued, but now the aspect of it that is that we are looking at it in mental health, in the maternal and child health project programs. So on the whole, let me also not forget about the significant role played by pharmacists, a group that is based in the Netherlands. They have been partners in most of the projects and programs that we've had as far as quality improvement programs concerned, Med for All program, and also GIZ of Germany help us to implement one of the largest NCD programs that looked at how we can ensure that non-communicable diseases affecting gender, generations, and geography along the broad spectrum, people do not die unnecessarily, because NCDs are now one of the causes of morbidity and mortality in the entire health sector. So,
I'm sorry, Peter, because some listeners will not know what NCDs are. Can you explain it?
NCDs are non-communicable diseases, hypertension, diabetes, and the rest, chronic conditions that could be well managed so that we reduce the extent to which people would die from it, ensure avoidable mortalities. So if you can really detect incidents of NCDs in group of people and start interventions earlier, you save people from dying unnecessarily. So avoid that. So we're always looking at our interventions. How can it ensure that people do not die unnecessarily? That you can add quality of life to life lived. You can ensure that people become more productive and become vital instrument. Yet they live very purposeful, sustainable, and productive lives within the community that they live. So that is, these have been our hallmarks of our project. So we've relied mainly on partners, and one of the key assets we've had that we're able to attract and retain partners has been our ability to receive funds, implement and account for it because of our robust governance and accountability mechanisms. And so that is what CHAG is known for throughout our history.
Okay. Thanks. And a quick, another additional question about the funding. So do I understand it correctly? Because you're mentioning about, UK aid, USAID. So those are government agencies who provided you with resources. And so do you also have a number of NGOs? Because you mentioned in the beginning of a conversation, Court Aid, for example. Are they supporting your work, or is it mainly government-related agencies?
Yeah. So Corded, I would describe Corded as a historical partner. Corded is no longer active in the health sector, but in the past, there are some of our past partners that need to be acknowledged and then Danida, they are no longer having development partnership relationship with that. UK Aid used to be very active, now not directly. We are hoping that they come back. Of course, we are also aware of the shifting paradigm of development architecture in the global space. And occasionally we have some partners that emerge, but we are also fully aware that partners have cycles and seasons. They come in at any point in time. But the good thing, though, is that because we built some repertoire or some record of credibility in our ability to receive funds, deploy fund, implement, and show evidence of results, social impact stories, we always explore partners who are also aligned with our mission of promoting health and healing and well-being and targeting the underserved who are interested in equitable social inclusion and development. So CHAG is always is open very much in exploring opportunities for development, sustainable development, especially ensuring that we complement the government. We are aware that there are always gaps in the way development is designed by government. There are always overlaps in areas where government sometimes over concentrates and leave others. So one of the key um, strengths of CHAG, because it's our community reach, community engagement, so we're able to identify community needs. So we always run targeted and tailored programs to ensure that people who need our services most come to us. So CHAG, our door is always opened to explore partners who are interested in becoming stakeholders in giving agency and agency to people in the community who need to be included in the development journey and have that shared peace and prosperity in the global world that God has given us.
Okay, let me try to ask you a question about something else that I heard you say. Because those agencies that you mentioned that are supporting or have supported your organization in the past, what is very important there is that um, support and aid is giving to all, to everybody, regardless of religion, race, etc.
Fair.
Now, help me here because you are a Christian organization, and I think I heard you say evangelize, the word evangelize. So can you please explain that? Because if you are receiving funding, from the different agencies, and you are supposed to, do that regardless of religion. So how does that work for a Christian
Yes.
organization like yours?
Yes, very. I think that is very that's a good question, and it strikes it strikes at the core of our foundation as a humanitarian, faith-inspired people who are serving the needs of the people who need our our resources, our engagement most. And so, first and foremost, CHAP operates on the principle of unity in diversity. We believe that polarities should rather serve as means, as possible in terms of harnessing synergies, bringing people together. We believe that the ultimate measure of our ethics, morality, and values has to be people-centered health services. We promote inclusion and diversity and equitable access to our health services. And so, whilst we are inspired by Christian values to evangelize the people through health and healing, we don't proselytize, no. So much so that we are located in places that serve the needs of broad spectrum of people, irrespective of socioeconomic status, religion, race, gender. And so we have an interesting case where we have child facilities located in places where 99.9% of clients are Muslims. That we demonstrate God's love through the services that we provide, through care and compassion, and we don't proselytize. Our identity is about love and compassion. We are inspired by our values of seeing every human being as a representation of Jesus Christ, so much so that we are accepted everywhere we are, because the foundation of our existence is to ensure equitable access to the highest attainable quality of health services. And so our Christian identity is rather it's an inspirational instrument to bring everybody on board. It is not a divisive instrument. It is rather an avenue for us to become an all-embracing partner all over and over since 1885, when the first child facility was established by the Presbyterians. We have lived this particular value. We have demonstrated the values of compassion, care, to everyone who comes to us, and in health, education, and socioeconomic development. So much so that the government of Ghana sees us as indispensable partner in the way we identify with the people who need our services most.
Either help me to unpack this, because for me, I always talk about, defining, the words that you use is important, because otherwise there
Mm.
might be confusion. So in this case, can you try to explain what is the difference between evangelize and proselytization? What is the
Very good. So, first, when you are evangelizing, you use works other than words. There was this, I think St. Francis also, who said, go out and evangelize to people all over. And if possible, use words, meaning that works, being the salt and light, people matter far more. You don't need to use words. You don't need to use words at all. But when you demonstrate the love of Christ to everyone who comes to you, because Jesus Christ or God in his own wisdom let the sunshine, the sunshine uh, blow over everybody, rain falls over everybody. And the love of God is universal. God is a creator. You cannot discriminate against God creation. You are just an instrument. It just happened that you were born in a family that believes in one Abrahamic root of of worshiping God. Either a Jew, Muslim, or Christian, all of them are the same roots. So it is just about living the values, the virtues, and demonstrating the voices that show Christ's healing ministry. That is about that. But when you proselytize, proselytizing is trying to instrumentalize your identity and forcing people to embrace your faith. That is not the essence of CHAG. Never. Don't talk about it. When a patient comes to you, it is your duty to provide care, love, and services without words. You are not supposed to talk about the scripture or gospel. You're only supposed to demonstrate action, compassion, care. That is what it's all about. So there's a clear difference between evangelizing through works, care, compassion to people who need services very much. The needy, the marginalized, and then forcibly making your faith as a condition for people accessing the type of services. And so that is a clear distinction between evangelization and proselytization. In proselytization, you force people
Mm.
embrace your faith, and definitely that is not the pathway of authentic Christianity. In evangelization, you demonstrate God's love through works, through the right spirit, through sincerity, through love and healing. And through that, if somebody so believes that your actions, care, and love shows that indeed you're a Christian and wants to identify with it, that is fine. But that is not the essence of that. Remember, we are the salt and light of the world. Salt illumines, salt preserves an environment. Light illumines and takes away blindness. So in many ways, we demonstrate the salt and light of the world through the way we preserve Christian ethics and identity through the salt poetic. It's not a poetic phrase, but it is a metaphor. It is living true values and virtues of who we are, and the light showing that the world is blind if all that we care about is to talk about who we are other than demonstrating what difference we could make in the lives and livelihoods of the people who need our services most. That is what we
Okay.
mean.
Okay. No, thank you so much, Peter. I think that's really helpful for the listeners. I'd like to go a little bit back when you mentioned you made a comment about that, the sector is facing some challenges. I mean, you mentioned USAID. They have more or less been dismantled, or at least it's unclear, you know, if it will return and what it exactly will do. Do you see the effects of that? in your work?
Yes, absolutely. Let me talk from the global angle. When development aid is cut, naturally, there are disruptions and throughout, and um, projects and programs that have leaned so much on aid naturally will suffer some. Will suffer some discontinuities. Um, we CHAG has is a bit lucky to have some aspects of the programs that are still continuing. That is faith in the area of maternal and child health. That is the positive residue of the SY USAID. And we are very grateful to the American government for ring fencing an aspect that promotes maternal and child health, and we'll always be on that. But on a larger scale, generally, beyond USAID, we've seen gradual, significant, monumental shift of most development partners moving away from direct support to faith-inspired groups and looking at G to G, government to government, using aid as diplomacy, a diplomatic tool. And so it has been a challenge for us to fill that particular gap. Um, Danida left, the Danish Development Agency left Ghana some time ago. They supported CHAD, they were supporting health system strengthening, and they are no longer in Ghana. The Dutch people, we're always grateful to them. They supported us years past, called aid, and also when it came to the health insurance, they were also key actors. Danida was also helpful. Now all of them are out, so there are gaps in development, and several other actors and partners that are pulled out of the entire health sector. So without that active instrumental support of these partners, it will be a challenge. And remember, we need two key actors in the development architecture. We need donors and doers. And that's why it is partnership. A donor is a partner because they give support for an anticipated impact. And for us, we also have the implementing arm. So within the global arena of solidarity and subsidiarity, we need to see how we can cooperation, and collaboration to ensure that the shared peace and prosperity that the SDG expect, that blueprint, will come into fruition. And so development partnership is a mutual objective. And we are fully aware that if the global south is developed or have its fair share of global prosperity, it will help nip the bud of illegal migration, help in addressing climate change issues, ensure social cohesion, peace, and development. And so we need to be aware that within the ecosystem of our shared needs, peace, and prosperity, we also have to look at equitable allocation of resources to ensure balanced growth and development. So all of us will live in an environment that would ensure peace and harmony.
Yeah.
So there's always a need to fill that gap. So at the moment, we need to fill the gap that has been left by the departure of certain key development actors. And one of the key areas that we always advocate for is that the faith-inspired or faith-based health service providers are vital partners in designing and developing innovative local solutions to local problems or local challenges. And faith-based actors are trusted, credible actors that are able to support the growth and development of any country, any environment. And they are more stable because governments have shorter lifespan. Faith-based actors provide a type of stability and predictability and continuity in growth and development architecture. And as we think or review our development architecture and paradigm, we have to recognize the vital role faith-based actors play in promoting the peace, growth, and development of the planet that we are responsible actors that are supportive of worthy causes for the interests of people and planet.
Okay. Thank you so much, Peter. I think you've been very clear, and I think it's very insightful for the
Mm.
listeners in terms of what you do, but also what is happening at the moment in the world, and there is more to be done, and we need to continue to work towards that SDG, Sustainable Development Goal, as the framework for making this world better and more just. I would like to go to the last part of the conversation, and it's a little bit more rapid fire because there are a couple of questions that I really would like to ask you before we part. So if you can keep it, rather short,
Right, right.
your answers.
Yeah.
The first one is piggybacking on the Sustainable Development Goals. There is a growing group of people that said, one of the reasons that we are not reaching those goals is, among others, that we did not pay proper attention to the abilities, skills, and knowledge that we need as individuals and as community to work on these system changes, structure changes, called the SDG framework. So they came up with the inner development goals. My question to you is, have you heard about the inner development goals? If yes, any thoughts? If no, also any thoughts? And the inner development goals are being, thinking, relating, collaborating, and acting. And under those goals are they identify 23 skills like empathy, critical thinking, compassion, etc.
Yes. Let me put it this way. I think one of the key, among all the goals, 17 goals of SDG, one of the areas that I really feel is probably far more important than the rest has been this goal 17, which look at strengthening means of implementation and revitalizing global partnership for sustainable growth and development. It's clear about cooperation, collaboration, collaboration, and of course, um, partnership architecture. And it is only possible when we build a skills of individual part of communities. Now, I always recall Ubuntu. Recently, Ubuntu, you are, I mean, I am because you are. And the inner that IDG, the inner development goals, I summarize them into two key arenas. It's about emotional intelligence capabilities and social intelligence skills, where we create that level of self-awareness, self-regulation, empathy, social skills, engagement, and the way we can come together and harness the inner capabilities, skills, and attitudes. It is only when the individual becomes very capable and skilled and will give agency to an individual that the individual can contribute to creating a just society. And so I've heard about it, and I believe strongly that it is time for us to see how we can create learning and development opportunities for individuals and see how every human being is part of a larger whole. And not only an individual, but also come into organizations because the inner reflects the outer, and the outer is also a reflection of the inner. So that intersection between the inner and outer of individuals, organizations, and entities reflect very much, because if the paradigm is wrong, definitely it will be difficult for all of us to become uh, key global actors and players in promoting development. So SDG important, IDG very relevant. All of them intersect to ensure that we can the type of shared peace and prosperity that the world needs.
Great. Okay, then in relation to that, you talked about partnership, and the first thing around partnership is about connecting people. What I hope is that the podcast is, positively contributing to connecting people. We are connected. I connect you with the listeners. I'm also going to connect you with the previous guest. And the previous guest has a question for you.
My question for the next guest is a question that we've been including in our also educational programs. Um, because of, I mean, post war and post trauma. Um, So to deal with post-war and post-trauma, we've been asking people, what is your dream? To remind them to have a personal dream. And the other question, what amazes you? Because we need a sense of amazement in this world where we're seeing so much harshness.
Good. My dream. I am a person of ideals. I'm a person of reality too. Ideals and reality. I always go back to the original mandates that were given as people of God. He said, be fruitful and multiply. I said, be the light and salt of the world. So we have already been given a mandate and identity. So my dream is to live a life of purpose, a life where all the ideas that are in me is ignited through shared partnership, my ability to really contribute to the growth and development of the world, and to make meaning of all the years of life that has been given. Because every day, every moment is an opportunity, and to address systemic poverty, that $1 can be, can make huge difference, and provide a type of leadership that leadership must not be about tenure of title or title. We should transition from tenure or title mindset of leadership, but it will imbue in every human being the capacity to think, develop, and share peace and prosperity. And that is what I dream, that a world free of discrimination, a world that is about inclusion, diversity, a world of shared prosperity, a world where all of us will always meet, smile, and together we can address our collective action together. A world of resilience and determination in whatever we do. That is my dream. Dream where we move from silos to synergies, that the world is full of possibilities and opportunities. A world that moves away from being blind to seeing the light of the day, every moment. That is my dream. And I think that a world where all of us are leaders in our individual capacities and societies, that we are able to make things happen wherever we are. That is my dream.
And
The
what
second point,
amazes, yeah, what amazes you?
what I'm always amazed about our capacity to rise up from adversity, our capacity for resilience, our ability to take charge of our own life despite crisis situation. That what amazes me is one change of mindset and paradigm is enough to change us from becoming dependents to providers. So the human spirit is so amazing. So we may lack resources, we may lack, environment, but the human will is probably what amazes me. That one encounter of the light, one encounter of truth, one opportunity can transform the lives of people. One interaction changes. So determination, resilience, mindset is what I believe what defeats cognitive dissonance, what is able to align us with the values of the world. And I'm always amazed about the resilience of the human spirit and our capacity to change for better if we are so much attuned.
Your question for the next guest.
My question: how do we move from awareness to action? We are aware of all the SDG, from MDGs to SDGs. How do we move away from rhetorics to practice? How do we identify systemic barriers and become real change agents? It is time to become change agents. We have all the ideas of development. How do we become actors, doers, other than theorists?
Okay.
That is my question.
Mhm.
And this is an existential question for all of us as human beings. So we want ideas on how to translate policy into practice, how to become moral voice agents, and how to be instruments of impactful change and social missions that will enhance lives and livelihoods all across. That is my question. So probably you may also add when. How and when do we do this? The time is now. Tell us how we can do it.
Um, Peter, and music is very important to me, so I always have a question about music as well. And most of the guests find this the most difficult question. I'm still going to ask you the question because I would like to know. Um, and that is, if I ask you to come up with a piece of music or a song that best embodies for a big part who you are, who Peter is, which piece of music or song would it be and why?
I think this is a very interesting question that resonates with my upbringing, and I hesitate no further to record the special song, Amazing Grace. Amazing Grace. Amazing Grace, how sweet the sound. You know that particular song? And there's one aspect that resonates so much. He said, I was once lost, but now I am found. I was blind, but now I can see. Those lyrics are so powerful to me. And one person who sang it and it connected me was Kenny Rogers, the late Kenny Rogers. He sang those songs, and his husky voice and that engaging lyrical pitch and tone, it's about enlightenment, about how we are all groping in the dark, how we need the light of leadership and the salt of preservation to always be in constant alignment with grace. So if we can be aware of who we are, what we are, if we can be aware of our prospects and potentials and the pitfalls that engage, and yet our capacity to be transformative agents, then of course we would demonstrate gratitude to our Maker and always go back to Genesis to say, be fruitful and multiply. That lyrical piece, that aspect, embodies my philosophy that always help us to see our prospects and potentials. Help us, to be found in our Athena. Because when we tune in into the vibrational harmony to the right frequency, we'll have the type of sound that are required. We have the tape, we have the body, we have the spirit, and often we are misaligned with the vibrations. So Amazing Grace is what drives me most. And I can't always go back without recalling that particular song. Amazing Grace.
And thank you for that, and also mentioning the specific rendition, because we have a on Spotify we have a playlist with all the songs that have been selected by my guests. We did have Amazing Grace, but not this particular rendition. So we're going to add the Kenny Rogers rendition. So thank you for that. If you go
Amazing.
to Spotify and you search for hashtag Walk to Listen, you will
Well,
find all the songs that have been selected, picked by my guests. Um, Peter, these conversations always go fast, but before I thank you for today, is there any question that I should have asked you today, but I did not?
I think we have explored several thematic areas from personal and professional background and experiences, our philosophies, our perspectives, and paradigm. And I think I look forward to seeing how together we can be transformative agents of change that will be impactful. I think the world is full of possibilities. I am an optimist. I'm also a realist. And so it is time to uh, demonstrate optimism in real action and always ensure that whilst pessimism is always an avenue for us to be cautious, we must always ensure that optimistic outlook of life brings hope, light of the world, and together we will fulfill our mandate and mission of being God's instruments for growth and development and bring health and healing to the greatest number of people that need our help most. In that, we will find fulfillment in our day-to-day lives. Without being partakers in growth and development, probably we become irrelevant and we die without legacy or any memory of whether we were once in the world. The only way to be citizens of the world is to leave a legacy of significant success and impact for people, for ourselves, our families and communities and the global world. Thank you so much.
Peter, Peter Yeboah, the Executive Director of Christian Health Association of Ghana. Check out the podcast notes for the website and all kinds of other information about Peter and his organization. Peter, thank you so much for everything you do, for who you are, and all the best. Take care.
So much. Much a pleasure talking to you, Maurice. God bless.
Bye-bye.
Bye.
Thank you for listening to Walk, Talk, Listen. Please check us out on 100mile.org or follow us on Facebook or Instagram.